What's going on, everyone? Happy Thursday and welcome back to my channel. Hopefully everyone is doing well, staying safe, healthy, having a great day so far, and testing negative for all those viruses that can make us sick. It is time now for the Thursday edition of the Virus Update for Thursday, November 13th, 2025. If you're new to my channel, welcome to my channel. You just clicked on to today's Virus Update, where we will go over all the viruses that are making people sick. Why do we do that? Because the news doesn't really do a good job of that. And when they do come out with information about the viruses, oftentimes it's too late or after the fact, while people are already getting sick. Want to stay informed with what's going on? Just subscribe to my channel down below. If you like today's video, give it a thumbs up. Hit that notification bell. Share this video with anyone you know. Leave your comments down below. And you can support the channel, such as Patreon, or even becoming a channel member down below. Alrighty, we do have a few things in the news department to talk about today. One, which we'll get to in a little bit, which is kind of serious. We also do have new data from the UK, and we are going to take a look at some weekly data from CJS, some of our daily data, and also we will end today on just a little bit of wastewater information. Starting off with this, let's start off on a little bit of a good note, shall we? And that is that the CDC, this is coming from Sci-Fi, CDC reports U.S. and all regions are at record year-over-year lows for COVID positivity rates. That's 2.7% up to November 8th. 50% of regions, though, did see an increase this week, up from 40% last week. The mountain region is at the lowest since June 15th through the 21st. The Northwest is lowest since March 29th. Get this, the Southwest hits the lowest level since April 2nd, 2022, and New York and New Jersey, the lowest positivity level for COVID since July 10th of 2021. That is some fantastic news. The Southeast hits a new all-time low 2 weeks in a row, but, everything that's down will eventually go back up. We've been starting to see wastewater go back up, so yeah, I don't think this is going to last much longer, but take the good news when we can get it. All right, moving on now to this from Dennis the COVID Info Guy. COVID outbreaks in Australian residential aged care facilities up to November 6, 2025. Active cases, 186, stable, that's good. Active outbreaks, 34. Hey, that's down by 10.5%. Resident cases, 133, that's down by 12.5%. Staff cases, 53. That's actually up by 55.8%, and not surprising. Actually, it's kind of a surprise to see the number of outbreaks down because parts of Australia have been seeing increases once again for the viruses. Reported deaths in 2025, 400. Hey, that did not go up. That's some good news. Now, I got to show you this. I always do when we go over this. 7,604 aged care COVID deaths since the start of the pandemic in Australia. In 2020, they had 686. In 2021, 226. But again, in 2022, where some countries said, pandemic's over, 3,855 reported deaths was still high in 2023, 2024, and that number for this year is 400, which is higher than 2021. Do I think they will get higher in 2020? We're starting to get a little late in the year. I don't think that's going to happen. I hope that does not happen, but at this point, it probably will not happen. All right, moving on to more from Dennis the COVID Info Guy. And remember, I said some parts of Australia are rising. Well, New South Wales is definitely one of them. And this is their respiratory surveillance reports week ending November 8th of 2025. The COVID positivity rate now, that is stable at 2.4%. Number of laboratories reporting 3 out of 4. But here comes the bad news. COVID cases, 715. That's up by 13.9%. Influenza, 3,029 cases. That's up by 33.3%. Yeah, big increase for that. Not good because your cases are pretty high still for flu. RSV, 445 cases. That's up by 14.7%. Taking a look at the variants, the NB.1.8.1 is now at 28%. XFG is at 28%. PE 1.4 is now 19% of the cases in Australia. We'll have to see what comes of that. Also, LP.8.1 is now at 7%. BA.3.2 6%, JN.16%, and KP.3 is also at 6%. Now taking a look at this in Japan. This is where we come into our bad news. Flu in Japan is really starting to take off at this time. Flu is really getting bad over there. And in Yokohama City, an epidemic alert has been issued. Also, many other cities as well. Cases reported over there. Yeah, get this. 57,424 cases last week, more than double the previous week. Many hospitals overwhelmed with admissions. Partial or full closures of 2,307 kindergartens, nurseries, schools nationwide. 75% of cases are kids. And the variant for flu is H3N2. There are a lot of different flu variants that do exist, and I'm thinking maybe we should somehow put something together on the website, like a guide to the various different variants. I would have to do some research from the CDC to get that, but there's several different ones. I'll be honest with you, I can't keep track of how many different H flu subtypes there are, and I'm thinking maybe we're going to do something. We'll see. It would be a working process. It probably wouldn't happen right away. It would be several weeks from now. But again, H3N2 is the subtype of flu that is causing the problems in Japan at this time. All right, speaking of flu, let's see here. I'm pretty sure we do have... No, we don't have it queued up. All right, we'll get to that later. Whooping cough cases skyrocket in Texas, quadrupling last year's numbers. We've talked about this recently, and I just want to throw a number at you. The state has reported more than 3,500 cases of whooping cough this year. Yeah, that's really crazy. That whooping cough keeps going up, and it's not just Texas. It's going up in many different states. We've been seeing school outbreaks. Yeah, whooping cough, not good. That other story that I wanted to show you that I forgot to queue up, forgive me, it's not been a good long COVID day. We have a headache this afternoon. We're rather tired. I don't know if you can see it in my eyes or not, but yeah, we're really tired this afternoon for some reason. Anywho, that other news story was Snohomish, Washington now reports its first flu death of the 2025 to 2026 season. So that's the other bit of flu news for today. We'll have more in a little bit, though, when we get to the UK. First off, we got to take a look at this before the UK. 3 new measles cases confirmed in Rockland County, New York. Yikes, not good. Just right off the bat, 3 new cases. Let's hope this does not turn into a full-fledged outbreak, but looks like one of the residents is coming back from international travel. So a resident who had recently returned from international travel tested positive for measles. As a result of that case, 2 other known contacts also became infected. Yeah, we've seen this game before, or we've seen this story before, whatever you want to call it. 1 becomes 2, 2 becomes 3. Let's hope it doesn't continue to multiply. That's something that measles has been doing pretty well this year. All right, taking a look at what is going on in the UK, starting off with influenza. And, well, thought we could take a look at influenza. There we go. The positivity rate for influenza in the UK is 13.3%. Healthcare usage over the last 7 days, that's actually down by 0.1%. Okay, but again, the overall charts, take a look at this. The flu positivity rate, it's just exploding at this point. It is rapidly going up, and I think they are probably going to get to where the levels were of last year. I mean, it's going vertical. It's going straight upward. Now, there is some slightly good news. Can we actually zoom in this chart? We cannot, but take a look here at this age 5 to 14 years. That's like a green line. You can see there, age 5 to 14 years. Yeah, that positivity rate has actually dropped a little bit. These are weekly positivity of people receiving a PCR test by age. So 5 to 14 years old has dropped a little bit, but age 80 and over is going up. It's kind of hard to see all the other age groups at this time. Yeah, they are going upward. All right, what did we want to take a look at next? That's right, let's take a look at what's going on with the website. Is there anything to see here today? Not really. Been updating the tracking threads a little bit. Not much, though. I'm sure I'm behind on things. That New York measles case, that does need to get over in there. We do not have a tracking thread for flu deaths. I don't know if we're going to do that. Not all flu deaths make news stories, and I think that would be just too hard to do. It's something I thought about doing, but I don't think it's something we're going to do. What we might do is we might set up like a new guide section on here somewhere. Like, for example, I said I want to talk about subtypes of flu. maybe we'll do something like that down the line when I get a chance. It's not going to be anytime soon. Probably maybe next month. I don't know. But let's see what's going on now. My website, by the way, datareport.info. Let's see if there's any change in Canada. Nope, no change. COVID activity in wastewater is moderate. Flu A moderate. RSV is moderate. No detections of flu B. Okay, that's good news. We'll take good news when we can get it. Let's see what's going on with air qualities in the United States. Let's zoom this out and refresh this so it shows the whole United States. While we're waiting for that, let's pause and take a hydration break, shall we? Water is the drink of choice today. Alrighty. Doesn't that feel much better? Alright, taking a look at what's going on with the West Coast, and we can see on the West Coast, still some bad air qualities there. I'm hearing the West Coast may see some beneficial rain. That's some good news. I've kind of been out of the loop with the weather patterns. I've been following local weather, but haven't really looked at the West Coast. And if you do see rain, that'd be fantastic news for these wildfires. Pacific Northwest still seems to be the worst region of the United States, even Southwest Canada as well. Looking here in the state of Washington, Oregon, still some problems. Also, northern Idaho, right near that Canadian border, is also dealing with some problems still as well. Let's take a look at what's going on when it comes to EMS calls, and we do see there are several calls here for sick persons. 1, 2, 3, 4, 5, 6, at least six person calls. That's not good. Taking a look at what's going on with the hospitals in Maryland today. Oh, why did I have to refresh that? Didn't look so bad. Now I refresh it, I'm seeing 3s and 4s, 2s. Don't get me wrong, there are a lot of 1s, but there's also a lot of 4s showing. 4s are bad. In case you need a reminder, maybe you're new around here. A level 4 on the emergency department index means 131% or higher occupied at a hospital. 3, that's not great either. That's 101 to 130%. And 1s and 2s aren't terrible. It's just when we get above that number, it does really get bad. 1 is the best possible number. 1 means you're not doing that bad, especially if you're closer to 0. All right, taking a look at this. Let's see. We actually have to. Oh, see, I told you. Unprepared for that one today. Wednesday's EMS calls in Philadelphia, 765. That's higher than the 600 something they had yesterday. But again, hey, we're below 800. I'll take it. I like seeing my city below 800. I wish we could show EMS total call volume for other cities on a daily. We can't. We've tried looking, and I haven't found any other places. Here is the CAD for Montgomery County, Pennsylvania, EMS incidents, and we can see here there are currently 12 incidents. It's 4:21 in the afternoon, one of them being respiratory. Taking a look at what's going on with Chester County, Pennsylvania, and this looks fairly busy for Chester County, Pennsylvania. We do see sick person, emotional disorder. We just see a general mixture of everything going on. Bucks County, Pennsylvania, at the start of this video, did have 11 calls. Let's see. Let's refresh this. Hopefully that number went down. It did. It went down to 6. So, respiratory distress, stroke showing up, and a few other things at this time. Let's take a look at what's going on with the hospitals in Pennsylvania. Again, not bad. I find it very odd that we haven't seen any updates from these hospitals in the Lehigh Valley or the Poconos, because if you recall, for the longest time, some of these hospitals were dealing with issues, and they haven't for a long time. So I'm wondering, are these reports even updating? I'm clicking on them. I'm not seeing anything. Let's go to one of the, wow, Southeast PA. 1, 2, 3, 4, 5 hospitals now dealing with problems. That's not good. Yeah, the hospitals in Southeast PA are updating. Look at that. Lankenau Hospital. Emergency department overcrowded. Ooh, that's not good. Look at that. All the hospitals on the main line, which is, essentially this corridor I'm showing you right here, are dealing with problems at this time. That's not good. New Jersey, what's going on there today? In New Jersey, we do have a specialty issue at Mannington, Penn Princeton Medical Center, psychiatric issue. Robert Wood Johnson University Medical Center, psychiatric issue. And what else is going on? That's it for today. Taking a look now at New York State, and we do need to refresh this. Has there been an update from New York yet? Yes, there has. 335 new COVID cases, and that number does continue to drop. Taking a look at what's going on with the hospital situation, and we can see it looks like hospital admissions this week about the same as last week, but just 2 higher. It was 298 last week, 300 this week. That is some good news to see that there have only been 300 admissions in the past, or at least at this update. All right, taking a look at wastewater real quickly, because there has been a change here. You need to see this. The Northeast for COVID is listed at high. The Midwest is listed at high. Now new. The Southeast is now listed at moderate at this time. Let's take a look at that trend map, shall we? And we can see here, yes, there definitely is a little bit of an increase here. Some of this will get corrected, but even if you correct that, things are continuing to go up. The good news is, look at this blue line. That's the West. The West at this time, not really seeing a rise just yet. We hope that trend continues. All right, let's see if we can get this week's update from Ohio, which should have just come in. Uh-oh. We're seeing 3 red up arrows. RSV in Ohio, 28 hospitalizations. That's up from 14. Hey, that doubled. That's not good. Flu, 37 versus 18 last week. And COVID, 137 hospitalizations. Hey, that's up from 129 last week. We've been watching COVID in wastewater in Ohio. Let's show you that real quickly. You can see here, COVID in wastewater in Ohio. Youngstown, Ohio is high. It was high in Akron yesterday. What happened there? Did it drop? Let's see that chart. It did drop a little bit, so it's down to medium now. That is some good news that it went down a little bit, but still it's not low. And Ohio, again, I wish we had wastewater for Columbus, Ohio. I mean, come on, that's a really populated area. Cincinnati also is. I mean, there's several more populated areas. Columbus, from what I gather, and I do have a lot of relatives there, Columbus is one of the fastest growing cities in the country, so we should be checking the wastewater there. All right, let's take a look at some data from CJS, and that will be it for today's video. Starting off with some COVID numbers reported over the past 7 days. Florida, November 1st through the 7th. These first 3 are from November 1st through the 7th. 1,125 COVID cases and 32 state-reported deaths. New York, 2,262 cases of COVID, 10 state-reported deaths. Puerto Rico, 368 cases and 2 state-reported deaths. The rest are weekly tallies reported last Thursday and Friday, as well as today. Arizona, 641 cases. California, 1,404 positive tests and 35 state-reported deaths. Connecticut, 472 COVID cases. Louisiana, bad news here. 451 emergency department visits for COVID-like illness. So your COVID's not going up yet. But get this. They also reported 1,090 emergency department visits for flu-like illness and a flu test case positivity rate of 6.4%. Yikes. Over 1,000 flu-like illness emergency department visits already. Maryland, 257 COVID cases. Massachusetts reports a net of 532 COVID cases and 6 state-reported deaths. Minnesota, 322 cases and 5 state-reported deaths. Let's pause and take another hydration break, shall we? I need it. That is much better. New Jersey reports 1,104 cases and 3 state-reported deaths for COVID. North Carolina, 272 hospital visits for COVID-like illness. Texas, 677 cases and 21 state-reported deaths. Virginia, 756 positive COVID tests. Wisconsin, 202 positive COVID tests. Nevada, Clark County, where Las Vegas is, reported 1,291 COVID cases in the month of September. October's count of COVID cases for Clark County is not known yet. Alrighty, folks, that does it for the Thursday edition of the Virus Update. If you enjoyed today's update, give it a thumbs up. If you're new here, subscribe down below, hit that notification bell, share this video with anyone you know, and leave your comments down below. Also, ways to support the channel, such as Patreon, becoming a member of the channel, are listed down below. We will have another virus update again tomorrow. The United States government is now reopened. I don't know if or when we're going to start receiving data from the CDC again. The banner of the shutdown has been removed from some of the CDC pages, from what I understand. That's a step in the right direction. We'll see if we get any new CDC data tomorrow. I'll refresh the pages before doing tomorrow's virus update. For me and my long COVID self, I will see you again tomorrow. Until I see you again tomorrow, stay safe, everyone, and have a fantastic Thursday evening. Thanks for watching.